So thanks very much for that introduction. I'm really pleased to be joining you. And I want to thank Colby also for that conversation. It brought to mind a series that PBS aired called Unnatural Causes, which had a segment on an indigenous group in southern Arizona. I can't remember, I think it was something like Odom, that their traditional agriculture had been disrupted by water policies, and that never was figured into the conversation about the very high prevalence of diabetes in this group. So agriculture is really important to all of us. I'm going to be reflecting on my time as both a deputy commissioner and as health commissioner in New York City, a period that ranged from 2002 to 2018, and talking about some of the policy approaches that the department took in that time to the rising tide of overweight, obesity, and increasing prevalence of diabetes among adults. I'm going to just talk about it with no slides, and I am, though, going to try and give you some of the data. When it comes to the question of equity, which has been an organizing principle of my working life, the position of the department in those years, which were largely under an activist commissioner, Tom Frieden, and an activist, very public health-oriented mayor, Michael Bloomberg, their view was that a rising tide would raise all boats, that a policy initiative that would advance the availability and ability to make healthy food choices would be good for everyone. And so there was no specific equity lens, and I hope that we can have a conversation about that. So the policies that I'm talking about are ones that have subsequently gained national attention. They include calorie posting, trans fat restriction, the introduction of food standards and procurement practices, the reduction of sugary beverages made available in the New York City school system, a very large system. And some of these are now under, the FDA is working to take trans fat out of our food. It's also tackling the presence of sodium in our food. Calorie posting was part of the Affordable Care Act. Believe it or not, that was in 2010. That was to go into effect in 2015. And of course, many local jurisdictions also followed New York City's lead on these. I want to talk about these as sort of innovations that were pioneered by a health department based on its data, and also based on what seemed like common sense. It seemed clear that the rising prevalence couldn't be attributed to individual choices alone, that we had a situation in which there had been structural changes in the way in which people got their food, the kinds of food choices that were made available to them, many more women working outside of the home, a higher proportion of people eating prepared and processed food as part of their diet. In New York City, a third of calories were calories consumed from purchased prepared foods. And the idea being that we needed to switch the lens from thinking about people needing to be educated about making healthy food choices to making it possible for people to have healthier food choices available to them. The fact is that, and I'm very proud of many of these initiatives, which I'll go through in the 10 or so minutes remaining to me. But the fact is that I can't really tell you that this is a story about success. In 2012, and New York City has the benefit of lots of data. Every year, a community survey is done among 10,000 New York City resident adults. And since 2012, the prevalence of obesity and overweight by self-report has been about the same, hovering around 60%, about a quarter of adults reporting obesity. And this is up to 2017, the most recent data that are publicly available. The prevalence of diabetes, when I joined the New York City Health Department in 2002, was about 9%. About 10 years earlier, it had been about 3.5%. But today in New York City, it's 12%. There are more adults reporting that they make healthier food choices. They eat 5 or more servings of vegetables a day, but the prevalence of sugary beverage consumption has remained pretty steady, between 22 and 24%. And these average numbers don't reflect real variation by neighborhood. In New York City, neighborhoods really count. New York City is a very segregated city by income and race, ethnicity. So, for example, in the South Bronx, predominantly Black and Latinx community in one neighborhood, Morrisania, Crotona, if there are any New Yorkers in the audience, the proportion of adults who say they drink one or more sugar-sweetened beverages a day is over 1/3. And that compares to the financial district, one of the wealthiest neighborhoods in New York City, where under 10% of people report daily sugary beverage consumption. And similarly, there is a very wide variation in the proportion of people who report obesity and overweight, with nearly 3/4 of South Bronx residents as compared to a much lower proportion in wealthy neighborhoods. So we have real inequities in the occurrence of self-reported food choices that are calorie dense and not particularly healthy, and in the prevalence of overweight, obesity, and diabetes. So New York City began in 2005, and I saw somewhere in the audience Angela Odoms Young, who may remember in the midst of time, or even before that, participating in an internal meeting at the health department in which some of these strategies were developed. So in 2005, the health department decided to make hemoglobin A1Cs a measure that we now use to assess diabetes and diabetes control, to make it reportable. And that has continued to the present day. A year later, the health department instituted calorie posting in 2006, which required all chain restaurants to put up information about the calorie content of their offerings. And at the same time, we required all restaurants, whether they were mom and pop shops or chain restaurants, to take trans fat out of food. In 2008, the city used executive authority to establish food standards for snacks and beverages purchased by the city. There was also an agreement to take sugary beverages out of the vending machines that were available in public schools. And in 2012, probably the most famous action was taken by the Board of Health, which was to limit the serving size of sugar-sweetened beverages. This was the only action that was overturned in the courts. All of these actions were challenged in the courts, usually on the basis of federal preemption or on the basis of corporate free speech, that by telling chain restaurants to put calorie information on their menu boards and on their menus, that we were making them say things that they didn't want to say. But the most famous action was the attempt to limit the serving size of soda mainly, and that we lost, greatly limiting the health department's ability to regulate on the subject of food. And in 2015 was the last action that I'm aware of the Board of Health that referred to sodium warning labels. And that put any item in a chain restaurant that had more than the daily recommended allowance of sodium, about a teaspoon of salt it was equivalent to, should be labeled as high salt food. So all of these actions have been really important. The only one that really changed the food itself was trans fat restriction. And in my view, it's the food itself that has become our problem as a nation. And the fact that these foods that are processed and prepared are low cost and more likely to be purchased by people who have low incomes than wealthier people is driving it. So I hope that we also can turn our attention to the problem of ultra processed food, food that is by its nature too salty, too sugary, too fatty, and too caloric. This is food that we can't make at home, but that now comprises over 60% of calories in the US diet. So I think I'm probably close to out of time. Somebody tell me in the chat. And I think that I'll stop here and say that I think it's very important that health departments take the perspective that people need more than simply information to confront the rising tide of low-cost, calorie-dense food that is so available to them. You need more than willpower than to address this, the presence of our current food environment. And that needs to be tackled increasingly at national level. There's limits to what a local authority can do in terms of ensuring that people have healthier choices available to them. So I will stop there and hope that we have time for a lot of conversation.